This is Accurate TV News,
where you get your news on time, on point, and online.
Stroke attack. Jamaicans are being urged to rush to hospital immediately after the onset of a stroke amid worryingly slow response rates and revelations that a third of local victims die from the brain attack and its complication. There are also fresh concern about the growing incidence of strokes among young people and its 40% non-recovery rate for productive workforce engagement. In 2021, more than 7,300 Jamaicans had a stroke and over 2,400 died from the brain attack and its complications. There are also plans to establish dedicated stroke units in hospitals to reduce death and disability through the provision of specialist multidisciplinary care. Consultant neurologist at the University Hospital of the West Indies, UHWI, Dr. Tamika March Donor said, Jamaicans does not have a stroke riskometer, a critical tool that assesses an individual likelihood of getting a stroke. Stroke has to be addressed as a non-communicable disease, and a part of that plan is to put a place protocol in terms of management for patients from the pre-hospital to the hospital to the post-hospital, and also an essential part is for primary care prevention, which is where the riskometer will come in. We are still having quite a high number of patients with stroke, and what we are now seeing is a shift in the age, the 30 to 40 year old compared to the 65 who were seeing previously, she told the Gleaner. March Donor revealed that 68.7% of patients had uncontrolled hypertension, 36.1% have diabetes, and for 27.2% of patients, smoking was identifiable risk factor. She said that the top 3 risk factors in Jamaica are all modifiable and, if addressed, could significantly reduce the number of people affected by stroke. We are resource stricken, and therefore in tackling stroke, we must have a big arm at the primary prevention level and a medium arm at the treatment of stroke. It is always better to prevent a stroke, and it is also cost effective, March Donor said. According to the World Health Organization, only 40% of Jamaicans who suffered a stroke last year recovered sufficiently to return to work. Over time, the loss of economic activity could account for 2% of the country's gross domestic product. March Donor explained that Jamaica is struggling to make thrombolytic, an intravenous tissue-type plasminogen activator, a single dose of which cost $400,000, and thrombectomy, a clot retrieval therapy readily available in hospital due to cost. These interventions reduce the mild to permanent disability of stroke patients who present to hospital unable to speak, walk, or swallow. The consultant neurologist said patients receiving the treatments would also have to be admitted to a high dependency unit. UHWI is the only hospital that has the capacity to offer thrombectomy treatment. Since January 4, patients have received thrombolytic. March Donor shared that 2 in every 3 Jamaicans who suffer a stroke arrive at hospital 12 hours after experiencing symptoms, well beyond the acceptable time frame for treatment to be initiated. It is such a shame. Within 3.5 hours is the optimal time, and up to 4.5 hours you can still get a benefit. After that, you can no longer benefit from thrombolytic. Up to 24 hours after, you can benefit from thrombectomy, but again, we don't have that readily established yet, she said. The main reason given by patient is that they did not realize they were having a stroke, or they tried alternative treatments before coming to the hospital. The data Data also showed that well-educated patients and those experiencing severe stroke symptoms tend to present to hospital faster. March Donor said that patchy ambulance coverage, limited availability of CT scanners in major hospitals, Jamaica's deficient road network, which creates difficulty for patients in rural areas, and lack of response knowledge are among the barriers of stroke care. Meanwhile, Minister of Health and Wellness Dr. Christopher Tufton has committed to establishing at least 3 stroke units at major hospitals in Jamaica over the next year. In collaboration with the Jamaica Stroke Alliance, the units will be located at Kingston Public Hospital, the University Hospital of the West Indies, and Cornwall Regional Hospital. Referencing last year's strokes data, Tufton said that facilities make strokes the leading cause of death in the country. It is a very important area to address. A lot of it is lifestyle or consumption habits, diets, exercise. Some of it is heredity, but what is very clear is that it requires urgent attention, Tufton said. March Donor and Tufton are members of the Jamaican delegation attending the 3rd Latin America Ministerial Meeting on Stroke in Sao Paulo, Brazil, as part of the Global Stroke Alliance 2022 meeting. This year's meeting will have in attendance representatives from more than 25 countries, 8 health ministers, and more than 100 national international guests.